All right, let's dive right into a systematic clinical review of dengue. We're going to cover all the high-yield, exam-oriented points that you, as a medical professional, absolutely need to know.
So here's our game plan. We'll start with the basics, the definition and classification. Then we'll get into the how and why, the etiology and pathogenesis. After that, we'll talk about what you'll actually see in a patient, the clinical features, how to diagnose it, and of course, management. And we'll wrap it all up with prevention and a super high-yield review to make sure those key facts really stick.
Okay, first things first. Let's tackle the definition and classification.
So, what are we really talking about when we say dengue? Well, the clinical definition is an acute flu-like illness that's caused by the dengue virus, or DENV for short. But here's the really critical part to remember. It has the potential to progress into a much more dangerous, even lethal complication that we call severe dengue.
Now, to properly assess a patient, we use a pretty straightforward clinical classification system. It starts with dengue without any warning signs. You can just think of this as mild dengue. Then you have dengue with warning signs, which is a big step up. From there, it can progress to severe dengue, and finally, the most critical form, dengue shock syndrome, or DSS.
Okay, so we know what it is. Now let's get into how it all happens. Time for the etiology and pathogenesis.
The main culprit here is, of course, the dengue virus, DENV. And it's not just one thing. There are actually 4 distinct serotypes, DENV1 all the way through 4. So how does this virus get around? Well, its primary ride is the Aedes aegypti mosquito. The Aedes albopictus can also play a role, but it's a secondary vector. And this transmission happens in a couple of ways. You've got the human-to-vector cycle that we see in epidemics, and also a sylvatic cycle that involves primates.
Now, what happens inside the mosquito is actually pretty fascinating. It all kicks off when the mosquito bites an infected person and gets a belly full of viremic blood. The virus then finds a home in the mosquito's midgut and starts replicating like crazy. Once you have all these new virus particles, they get released into the mosquito's circulatory fluid, the hemocoel, and from there they travel to the salivary glands. And that's it. The mosquito is now fully loaded and ready to transmit the virus to the next person it bites.
So keeping that transmission cycle in mind, what does this actually look like in a human patient? Let's get into the clinical features.
Okay, pay close attention here because this is clinically vital. You have to know the difference between the common symptoms and the really serious warning signs. The initial phase, which lasts about 2 to 7 days, usually presents with things you'd expect. High fever, maybe some nausea and vomiting, a rash, and those classic aches and pains, especially that telltale pain behind the eyes, the retroorbital pain. But, and this is a huge but, if you start to see warning signs like severe abdominal pain, persistent vomiting, or any kind of bleeding, those are major red flags. That tells you the disease might be shifting into a severe form, and you need to escalate care immediately.
And when dengue does turn severe, the outcomes can be, well, they can be dire. We're talking about the risk of shock, massive internal bleeding, and circulatory failure, which, yes, can be fatal. The absolute most serious form of this is dengue shock syndrome, or DSS. And we have to be extra careful with certain groups, specifically infants and pregnant women, who are at a much higher risk.
All right, so a patient comes in. They have these symptoms. How do you actually confirm your diagnosis? Let's talk about investigations and diagnosis.
Your diagnostic strategy for dengue really depends on timing. If a patient comes in during the first few days of the illness, you're on the hunt for the virus itself. For that, your go-to virological tests are RT-PCR, or for a much faster answer, the NS1 antigen test. That one can give you a result in around 20 minutes, which is a game changer. But what if the patient shows up later, say a week in? Your strategy has to pivot to serology. That's when you'll use an IgM ELISA to check for a recent infection, while an IgG ELISA will tell you if they've had a past infection.
Okay, you've got your diagnosis. Now what's the plan? This section is all about the core principles of management and the complications we're trying to head off. Listen up, because this slide is absolutely non-negotiable for patient safety. When it comes to managing the fever and pain, the only thing you should be recommending is acetaminophen, also known as paracetamol. You have to strictly avoid NSAIDs. We're talking ibuprofen, aspirin, all of them. And why is that? It's because their anticoagulant effects can push a patient who's already at risk into a full-blown hemorrhagic crisis. This is one of those points you just have to burn into your brain.
Now, for those patients who do progress to severe dengue, the entire management strategy revolves around one central pillar: meticulous, careful maintenance of the patient's body fluid volume. This is, without a doubt, the cornerstone of treatment. And getting this right makes a world of difference. It can take the mortality rate from over 20% all the way down to less than 1%. The whole goal of this aggressive fluid management is to prevent those two major complications we talked about, dengue shock syndrome and severe internal bleeding.
Okay, we've pretty much covered the disease from A to Z, from cause to care. Let's wrap things up by looking at prevention, and then we'll pull everything together into a final high-yield review.
Prevention really comes down to a two-pronged attack. First up, you've got vector control. This is all about getting rid of mosquito habitats, which primarily means eliminating any and all sources of standing water. Simple, but effective. The second prong is personal protection. This is about not getting bitten in the first place, right? So we're talking about using good insect repellents like DEET, wearing clothing that covers you up, and using mosquito netting.
All right, exam time. These are the points you absolutely have to know. 1. It's caused by DENV, which has 4 serotypes. 2. The primary vector is the Aedes aegypti mosquito. 3. Clinically, you must recognize the warning signs: severe abdominal pain, persistent vomiting, and mucosal bleeding. 4. For diagnosis, remember NS1 is your rapid early test and IgM is for a recent infection. 5. Management is paracetamol. I'll say it again, strictly avoid NSAIDs. 6. For severe dengue, your critical focus is on managing body fluid volume. And finally, number 7, the vaccine is only for people who have a documented prior dengue infection. Got it?
And here we go, the final rapid-fire recap. Let's lock it in. 4 DENV serotypes: vector, Aedes aegypti. Warning signs: abdominal pain, vomiting, bleeding. Diagnosis: NS1 early, IgM recent. Treatment: paracetamol only, absolutely no NSAIDs. And for severe dengue, fluid management is the key to survival.
Welcome to The Explainer. Today, we're going to be decoding one of the fastest-spreading mosquito-borne diseases on the planet, dengue. Okay, let's jump right in. Just take a look at this map. All the red and orange, that's where dengue can thrive. We're talking about a huge portion of the globe. This virus has a nasty nickname, breakbone fever, and that's for the absolutely brutal pain it can cause. It puts nearly half of the entire world's population at risk. But what does it actually feel like when you get it? And that's what we're tackling in our first section. We're going to break down how dengue goes from something that might feel like a really bad flu into a full-blown medical emergency. So for most people, this is where it all begins. Medically, this is what's called probable dengue. You've got a fever that just won't quit for a few days, maybe even a week. And on top of that, you have at least 2 other classic symptoms. You know, the headache, maybe a rash, or those aches and pains the disease is famous for. This is pretty much the starting point. Now, this is where things get really, really interesting. This diagram perfectly shows the critical turning point. You can think of it like a fork in the road. Most patients, thankfully, will go down the path to recovery. But for a few, the illness takes a very dangerous turn. And it's all signaled by a specific set of what are called warning signs. And that's why spotting that turn is so crucial. These 7 warning signs are basically giant red flags. We're talking about stuff like intense stomach pain, vomiting that just doesn't stop, or any kind of bleeding, say from your gums or nose. If you see these signs, it is time to get medical help right away. They are the absolute key to stopping the disease from becoming severe. And this is exactly why those signs matter so much. Because if they're missed, dengue can spiral into this: severe dengue. And this is a life-threatening emergency. Your blood vessels can start leaking plasma, you could have major bleeding, or your organs could start to fail. This is the outcome that doctors are fighting to prevent. So that leads to a really important question. Is everyone's risk of getting this severe version the same? Well, let's move on and take a look at what the data says about who is really the most vulnerable. The research points to 3 main groups. Now, the first one is a little counterintuitive. People who've actually had dengue before are at a higher risk. You see, getting infected a second time with a different type of the dengue virus can actually send your immune system into overdrive. Young kids are also more vulnerable, and so are people who have other health issues like obesity or asthma. And this chart really drives home that point about age. Take a look at chart C. It's showing mortality rates, and you can see this clear U-shaped curve. The risk of dying from dengue is highest for the very young, infants under 1, and for the elderly, people over 80. To really understand how all these factors work in the real world, let's zoom in on a country that has a massive share of the world's dengue cases: India. So on the left here, you've got a map of India broken down into 5 big regions. And on the right, you have a chart showing what's called seroprevalence, which is really just a fancy way of saying what percentage of people have already been exposed to dengue. And what jumps out at you immediately is that where you live in India makes a huge difference in your risk of getting this disease. Now, let's just focus on working age adults, people between 18 and 45. The difference is just staggering. In South India, more than 80% of people have dengue antibodies, meaning they've been infected at some point. But if you go to the Northeast region, that number completely plummets to less than 10%. That's a massive, massive difference. And there's another major split to look at: the city versus the countryside. Across India, the average exposure rate in urban areas is 71%. Compare that to rural areas, where it's only 42%. And that tells us something really important about the mosquitoes that carry dengue. They absolutely thrive in our crowded cities. So all this data is great for understanding where dengue has been. But what about where it's going? Can we actually predict what's going to happen next? Well, in our final section, we're going to dig into the science of how experts forecast outbreaks. So yeah, how do they do it? How can an epidemiologist look at an entire population and actually forecast the path that a disease is going to take? Well, it often starts with a really powerful but surprisingly simple concept. Scientists basically divide the entire population into three big buckets. First, you have the susceptible group. These are all the people who could still get sick. Then you have the infected group. They're sick and they can spread it. And finally, you have the recovered group. These people have had it and are now immune. And here's a peek under the hood. Now, don't worry about all the complex math on the screen. The important thing here is what these equations actually do. They work like a set of rules that calculate how fast people move from that susceptible bucket to the infected one, and then finally to recovered. When scientists plug in real data, they can use this to chart the course of an outbreak. It's almost like a weather forecast, but for a disease. And this modeling gives us a single, incredibly important number, R0, or R0. You've probably heard of this one. It's simply the average number of people that one sick person will go on to infect. And here's the key takeaway. If R0 is bigger than 1, the outbreak grows. If it's less than 1, it eventually fizzles out. Simple as that. Okay, so let's tie everything together now. This table shows the calculated R0 for dengue across India's regions. And get this, the southern region, the one with the highest exposure rate we saw earlier, it also has the highest R0, a whopping 3.48. Meanwhile, the northeastern region, with the lowest exposure, has a tiny R0 of just 0.13. The math lines up perfectly with the reality on the ground. So what's actually driving these numbers? It's not just about biology or climate. And this is a really critical point. This chart from a study in Vietnam highlights a huge man-made factor: infrastructure. What it shows is that dengue infection rates are way higher in places that don't have reliable access to tap water. And when you think about it, it makes perfect sense. Why? Because if you don't have running water, you have to store it in open containers. And those containers become the perfect breeding grounds for mosquitoes, right inside people's homes. And that leaves us with one final and really important question for the future. We know our climate is changing, and our cities are getting bigger and more crowded. Both of those things are practically a welcome mat for dengue. So as we look ahead, how much of our success or failure in fighting diseases like this will really be determined by how well we build our public infrastructure? Things as basic as clean water systems for everyone.